Welcome back to our channel. My name is Grace Gosnell and this is the Health Benefits Network. Today I want to touch on a topic that we're all starting to hear more and more about, and that's the drug Ozempic. Jimmy Kimmel joked about it at the Oscars, Chelsea Handler referenced it on a podcast, and even Elon Musk has gotten into the conversation. Before we jump in, I want to pause and say a quick thank you to our sponsor, Scoop Health. They're a big advocate for medical cost-sharing memberships that are a great alternative and so much less expensive than traditional health insurance for people who consider themselves generally healthy. If this sounds like you, check them out at the link below. I've been a member with them for several years, and I don't think you'll regret learning more. So, how did this medication, designed to treat diabetes, turn into the hottest new diet drug? Let's start by talking about how Ozempic works and why it got so popular. Ozempic is a once-a-week injectable medication that helps lower blood sugar levels in people with type 2 diabetes. It mimics the effect of a hormone called glucagon-like peptide 1, which helps to regulate blood sugar levels and also slows down the emptying of the stomach. This leads to a feeling of fullness and reduces the amount of food that people feel like eating, which of course can contribute to weight loss. And while this drug wasn't originally designed for weight loss, this common side effect is quite appealing to many people. I remember the first time I heard people talking about this drug as if it were some kind of miracle way to drop a few pounds. I was getting some makeup done before an event, and the makeup artist and her colleague were talking about having started the medication recently and how well it had worked so far. Without knowing that this was a prescription medication for treating diabetes, you would think someone had discovered the fountain of youth. Now, while Ozempic isn't specifically created for weight loss, this doesn't prevent doctors from prescribing it to patients who aren't battling type 2 diabetes. And while it's legal for doctors to prescribe a drug like this for an unofficial use, in a case like this, it can lead to the popularity of that drug becoming a problem. It's now very hard to find Ozempic in a lot of places, and this may lead to people who really need it to seek it out at pharmacies and drugstores out of their network, leading to them paying up to about $1,600 a month in order to get it. This can very seriously and negatively impact people who do need this drug to manage chronic conditions. There was a recent story from NPR about a woman who, after suffering a stroke at age 39, was prescribed Ozempic to help control blood sugar and weight. And while there was a very quick initial success, it became increasingly difficult for her to locate this medication that was so effective. This is largely due to the overnight popularity of this drug as a quick way to lose weight, and doctors prescribing it for such instead of focusing on prescribing it more for the individuals who have diabetes and could greatly benefit from this medication. Another angle that people may be unaware of is that weight loss that they were seeking and achieved while taking Ozempic might be easily regained after stopping the medication, especially if a healthy diet and exercise plan are not maintained. This is because the weight loss effect of Ozempic is thought to be related to its impact on appetite and metabolism. And when the medication is discontinued, these effects may diminish. For anyone looking for an easy fix to shedding a few pounds, this isn't a long-term solution, but hey, if you're a celebrity with a red carpet to look good for, then who am I to judge? All kidding aside, if you're not using Ozempic to treat diabetes and just looking to slim down a little bit, there's really no substitute for sustainable healthy changes to your lifestyle, like eating a little bit healthier and incorporating more movement into your day. Small changes over time like these will be your key to sustained success. And if you're looking for a quick jumpstart to get you going, I'd suggest checking out my video about some of the methods around intermittent fasting. I'll link that here in just a second. Before we wrap up, I would love to hear from each one of you. Let me know in the comment section what you've heard about Ozempic, your opinion on the rumors about how many celebrities have used it.
Jolo, you look thin.
Thank you.
Ozempic?
Yep.
And most importantly, if any of your friends or loved ones have had success with it helping their health. If you want to see more content like this, please hit the like button and subscribe to the channel, as I'll be coming to you with more tips and tricks around the world of healthcare and benefits. And to check out that video about intermittent fasting that I mentioned, click the link right up here.